Assalamu alaikum all, and welcome to the seminar on the COVID-19 aspect, coping with depression amidst COVID-19. I would like to request all the people who are joining us on free conference call to please mute themselves. We are also live on live on Facebook. So if your friends want to join in, you can ask them to join us on Facebook. Let's start. I'm very thankful to Durriya, Meer. These are very tough times for everybody, and what I have seen in the past 4 months, huge stress and depression going on among among my students. So I think it's very appropriate for us to have a session on this of how do you cope with depression in these type of environments. And I'm very grateful to Dr. Durriya, who has volunteered herself and her expertise to join us, explaining us and telling us how to cope with depression. Dr. Durriya Meer has her doctorate in philosophy from psychology from USA. She's used to work with the University of Michigan in the counseling and psychological services for 13 years before she moved to Johns Hopkins. She's currently the director of training and providing counseling services to university students. I think this is a great service. Almost all the universities have these type of services, and they are totally I will say one of the best services the universities are providing. Every have gone through depression or anxiety or stress sometimes in their life. So these type of services are very crucial for the better mental health of these students. Thank you, Dr. Durriya. I really appreciate you working with NED Scholars and putting down this seminar. Like all of the students who are joining us on free conference calls, so please mute themselves. Okay, Dr. Durriya, whenever you are ready, please go ahead.
Okay. Thank you, Dr. Sohail. First of all, thank you very much for inviting me to present on this. You're right that the world has turned upside down in the last few months, and any kind of mental health issues have become tenfold more important. Unfortunately, हमारे culture में we don't talk about mental health वैसे भी. So अब क्या हो गया है कि a lot of people are experiencing symptoms that they don't even know what's happening to them. So I'm glad to be presenting today, and when I presented last time on stress management, मैंने जो कहा था कि please feel free to share my email if anybody is willing to, if anybody wants to talk to me privately, or they just have to email me and then I can call them via WhatsApp or kuch bhi ho. I'm always happy to talk to them. So मैंने अपना presentation तो काफी brief रखा है because I think it's more important for people to ask questions and and have a discussion. क्योंकि जो technical factual knowledge hai, you can get it from anywhere. So I will start off by saying that I'm first going to talk about depression and its symptoms, and then I'm going to talk about ways to cope with it. मैं इतना बता दूं कि my Urdu is not very good, so I will be talking mostly in English, and except for I'll be weaving in and out of English and Urdu. I'll try to speak in Urdu also, but you'll have to forgive me if I make a mess. I don't have practice in Urdu anymore. Anyway, good evening everybody. Pakistan में तो अब कितना 7 बज गए हैं ना वहाँ. So good evening and thank you for joining us on a Saturday evening. All right. So the topic today is depression, and particularly depression amidst this novel thing that we have called COVID-19, जिसके बारे किसी को पता भी नहीं था, and there is no vaccine and there is no end to it. So anytime we are in a situation where we don't see a beginning and an end, human beings do not like that. Human beings, jitna bhi hum log kahe, yes, we like change, we like excitement, but human beings are creatures of habit. So being in this COVID-19 situation where, whether you are talking about the government or talking about the doctors, who unfortunately they also don't know a lot more than what they are telling us, partly because this is so new. Okay. So as we all know, this is called a pandemic. Matlab, it has impacted every part of the world. इसमें भी एक चीज याद रखना है कि जो those of us who are underprivileged in society, whether because of our health, because of our, physical health, because of our mental health, because of our socioeconomic status, the pandemic has hit us worse. And the reason I'm stressing that is to remember that जिनके pre-existing conditions है, whether it's depression, anxiety, stress, kuch bhi ho, because of this pandemic, the impact has been a lot worse. Okay, and like I mentioned a couple of minutes ago, we are in our part of the world, एक तो हमें awareness ही नहीं है कि what is mental health. ये आप जब depression के symptoms सुनेंगे, आप सोचेंगे कि a lot of people will think कि अरे ये तो laziness है, and that is one thing you have to remember, that depression is different from laziness. Laziness में but the symptoms can be similar. I hear it from our Pakistani, Indian and Bangladeshi students who grow up here. जब मेरे पास आते हैं student counseling के लिए, unfortunately, they also fall prey to the same thought, same belief that, oh, it's just laziness, and if I only do this, I'll be better. So, आपको ये ख्याल रखना है कि laziness is very different than depression or any other mental health problems. दूसरी बात ये है कि हम लोग हमेशा, at least until now, we've always thought of mental health problems as something that we have done to ourselves. हमने नमाज सही से नहीं पढ़ा, हमने माँ बाप की respect नहीं की, हम अच्छे मुसलमान नहीं है, and this is all because of our guna and things like that. हो सकता है, I'm not an Islamic scholar, so I'm not going to go there, but depression doesn't have anything to do with what you have done or what you have not done. Okay, it is an illness, and I'll talk more about it. So आपको ये याद रखना है कि depression is an illness just like any other illness. आपको जब fever होती है, आपको जब बुखार आती है, तो आप डॉक्टर के पास जाते हैं, and you have to treat depression in the same way. Okay, because there are actual changes in the brain. आप Google भी करेंगे ना तो आपको दिखेगा, आप just Google images of brain, of depressed brain versus normal brain. आप देखेंगे MRIs करके इन लोगों ने देखा है कि there is a huge difference. So the only thing is that when we have fever or something, हम thermometer use करके temperature ले सकते हैं. लेकिन unfortunately we can't do that with depression or any other mental health issues. दूसरी बात यह है कि अब ना हम mental illness नहीं कहते, mental health कहते हैं कि there are problems with the mental health. This is a more positive way of thinking about something, rather than thinking of it as an illness, because even the language we use, it can impact our mood, and there is a lot of research. So be careful, and that is actually one of the tips and strategies I would strongly suggest that you adopt, because adopting a positive language, a positive way to think about the environment, to think about the situation, is not going to cost you anything. Okay, so some common reactions to the pandemic, or one thing, Dr. Sohail, if questions come up and you want to ask me while I'm presenting, I'm happy to do that also. Okay.
All right. I will ask the students and those who are joining us, please send your questions through the private chat. That will be, if you don't want to have it open to everybody, so just send me on through the private chat. That will be much easier for you to spell out what you are going through.
Okay. So some
go
common.
Ahead, Dr. Durriya.
Oh, sorry. Should I go ahead?
Sure.
Okay. So some common reactions to the pandemic is a heightened sense of stress. Some of you may have attended my previous presentation, which was several months ago, of course. लेकिन मैंने कहा था कि उसमें stress is an everyday thing. There is no time that we are without stress. हम जितने भी relaxed हो, there is stress on our body because of the way we are sitting, the way we are, the way we are using our arms. कुछ भी हो, there is always stress. There's nothing wrong with stress per se. Lekin when the stress becomes distress, that is the problem. So a common reaction is this heightened sense of stress. क्या करूं, मुझे कुछ पता नहीं है. What do I do? How do I go out? How do I meet my friends? How do I take care of my health? These are all stresses. Anger, again, human beings are creatures of habit, and I will say that over and over again. We don't like change that is imposed on us. So कोई हमें कहता है कि भाई घर पे बैठो, we don't like that, and we often respond with anger. How dare you? लेकिन हो सकता है कि यह हमारा internal response है. लेकिन आप सोचे, जब भी आपको किसी ने कुछ कहा हो कि नहीं, you have to stay at home, or you have to do this, or you have to study, there's a part of us that reacts. Why should I do that? Okay. और ये तो this environment is such that you have no choice. The choice has been taken away from you, and that can lead to anger. Fatigue or tiredness, and here I'm talking about physical tiredness, mental, emotional tiredness, because after a while, when things don't change, unfortunately we have this attitude of giving up. Oh, things will never change. So आप लोगों ने शायद सुना होगा कि नहीं, हमारे ऑफिस में और हमारे फील्ड में तो इतना कहते हैं Zoom fatigue, वो Zoom जो the other platform for online therapy that we use, or for any meetings, just like free conference call. लेकिन अब सब, this is the new term, Zoom fatigue. Okay, whole day if you're sitting in front of the video, because our work is mainly to do with people, all day we are either in meetings or talking to, for me, I'm talking to students. So pura time, sitting in front of the video causes a fatigue. And of course, depression. Okay. So Let me go to the next slide. Okay, so let's start with what is depression. Okay, the first thing to remember, I mean, what I'm going to go through first are the symptoms, and then I will talk about depression in more details. Okay, so आप देखेंगे कि जो symptoms है, depression के जो symptoms है, all of us feel it now and then. हमें सबको, all of us go through it's like weekends में हम कहते हैं ना कि oh, I don't have the energy to do anything, or I don't have the motivation. आज अच्छा नहीं लग रहा है, मुझे नहीं करना है. So it's not just one time you feel like this and you are depressed. ऐसा नहीं है. This is a depression में these symptoms continue for at least a period of 2 weeks, and this is according to what we call the Diagnostic and Statistical Manual, and that is sort of a reference that we use for हमारे फील्ड में कहते हैं कि ये हमारा बाइबल है, because it has all the mental health disorders and इनके symptoms क्या है. So the first symptom is a lack of energy, a lack of motivation. Difficulties with focus and concentration. Because you don't have the energy, because you don't have the motivation, it's very hard to focus on anything that you're doing. थोड़ी देर आप एक पेज पढ़ते हैं और then oh, I just don't have the energy. या तो आप suppose you're even in pleasurable activities, you're looking at you're watching a movie, and after a while you just want to give up. This movie doesn't interest me. Okay. Another symptom of depression is sleeping too much or too little. We have this idea of depression. Actually, let me wait for that. Let me talk about this. Some people find that they sleep too much. 10 घंटे, 12 घंटे, 14 घंटे सो रहे, जब भी हो उनको नींद आ रही है. And there are some people who lose their sleep. But both of these are symptoms of depression. Another symptom is eating too much or too little. Some people actually their appetite increases. This is what we call emotional eating. You're eating not because you're hungry, but because that gives you something to do. फ्रिज में कुछ पड़ा है, चलो खा ले. बाहर निकले, कुछ दिखा, खा ले. It's not really because you're hungry. It's because it distracts you. It's an activity that helps to distract you from your depression. Some people lose their appetite. Using illegal substances such as drugs, alcohol, smoking too much, smoking too little, not smoking too little, smoking too much, other illegal substances, jo bhi students like to use or want to use. Feeling of helplessness and or hopelessness, and this is something that is really from a mental health point, this is what we look for, because this feeling of helplessness ke main kuch bhi karu, it's not going to make a difference, and the hopelessness that nothing will get better, nothing will can I come to your question later, the difference between stress and depression? Or do you prefer me to respond to it now? I'm fine. Okay, let me go through the symptoms first, and then I'll talk about stress and depression. Feeling of helplessness is that no matter what I do, it will be ineffective. Matlab, so for those of us who are following for example, an exercise regime because we want to lose weight, okay? This idea that even if I exercise 5 times a day and the related feeling of hopelessness, nothing will change. I will never lose the weight. Okay, so what happens with this helplessness and hopelessness is that we give up. After a while, we give up. एक तो we don't have the energy and the motivation. उसके ऊपर जितना भी हम कर रहे, it's not making a difference, so we tend to give up. And that is critical, because when you give up on things that you enjoy, when you give up, when you don't have a goal, when you don't have a purpose, it can lead to. Give me 1 second, my thing is stuck for some reason. Okay, so sorry about that. When you feel hopeless and helpless, it can lead to suicidal thoughts. And that, what's the point? That's the feeling you get. कि इतना कोशिश करने के बाद भी अगर it's not going to change, then what's the point? Okay. आप लोगों ने शायद सुना होगा, last Sunday an Indian actor committed suicide, you know, and obviously social media पे हर किस्म की बात हो रही है कि you know, Bollywood ने ये किया and people didn't support him and things like that. सब सही है, not to say that that's not true, but the real issue in all this blame game, the real issue is lost, that he was depressed and he had stopped taking his medication. Okay, so a lot of things can contribute to depression. A lot of things can contribute to this feeling of helplessness and hopelessness. But what we look out for particularly is any sign of suicidality. The other thing to remember is that, you know, हम लोग ये जो like I mentioned, language makes a lot of difference. Okay, we use the term depression and sadness interchangeably. You know, but you have to remember that sadness is normal. It is an emotion. We all feel sad sometimes. किसी से हम झगड़ा करते हैं या किसी ने हमें कुछ कह दिया, we feel sad, and that's okay. It's an emotion. It'll pass. Okay, depression is an illness. When you feel sad for a prolonged period of time, एक महीना हो गया है, you know, and you are feeling sad, then yes, that is now becoming depression. हम एक movie देख के आते हैं और, you know, the movie really touches us and we feel sad, that's normal. Okay, so using the term interchangeably is not correct. Again, that stress, that importance of language. Okay, I don't know about, I can't say about Pakistan that much, but at least यहाँ सबको बहुत आदत है, you know, especially younger generation को, I'm feeling so depressed today. But that's not depression, that's sadness. That's a feeling. Yeah, again, I want to be careful what I say because I don't know as much about Pakistan as I know about the students that I work with here. Lekin यहाँ के the students that we work with, you know, what we found, at least up to, you know, there's a huge generational difference. that they don't like dealing with negative emotions. They don't like dealing with things that don't feel good. So, थोड़ी बात में, oh, I'm depressed. And often our work is helping them understand that, no, you're not depressed. This is sadness. It'll pass. So, again, stressing the importance of language. Okay. Dr. Sohail, I can address some of the questions before I move on to how to deal with depression, or should I wait?
I think you should go ahead.
I should go ahead. Okay.
Yeah, I think it's good to answer these questions because these are very rare.
Okay, so should I
and I have
wait?
few too that are sent in the private message.
Okay, okay. Okay, so some tips to cope with depression, particularly during this time. Okay, recognize that each and every one of us is going through the same thing. What is different is how the perspective on it. I'll give you my example. मुझे ना घर पे रहना बहुत अच्छा लगता है. So while everybody is complaining about, oh, बाहर नहीं जा सकते, मुझे तो बहुत अच्छा लग रहा है. अरे I'll work from home, उसमें क्या हो गया? लेकिन my perspective is different from somebody else's. They need the company, they need the everyday interaction, they need the freedom of being able to go out. So because of the difference in the perspective, we respond differently. We respond differently to the situation. So even within this unusual time that we are in, there are things within your control. So it is very important for you to think what is in my control and what is not. Okay. For example, just a simple example, wearing a mask is in your control. Going out and attending a wedding is not within your control. So, आप क्या कर सकते हो? What are some of the things you can do given that there is an environment which is not within our control? And if you remember in the previous slide, I was talking about hopelessness and helplessness, right? This idea that nothing will change, this idea that no matter what I do, my actions will not have a result. Okay? So if you think about that, one way to combat that, one way to not give in to the hopelessness and helplessness is to think about what is in my control. For example, what time you get up, what time you eat your meals, okay, what time you go to sleep, these are all within your control. I understand that हमारा living situation भी ऐसा हो सकता है जहाँ we don't have control over some of these things also. It's okay, but there are still things within our control. Okay. For example, what music we listen to is within our control, or namaz padna na padna, that is within your control. Okay. So pay attention to those little things, and this is a situation where paying attention to these little things that can make a difference, and believe me, it is these little things that can make a difference. It's really important. Now you have to think about your perspective. What kind of a person are you? Are you an optimist? Are you a pessimist? Or are you a realist? And this is the difference between the three. Okay, so an optimist will always see the glass as half full. The pessimist will always see the glass as half empty. And the realist will say it's a glass filled with water and maybe I can drink it. Yeah. So आप देखेंगे कि in the first two there is a judgment. Okay. Oh, the glass is half full. The second one also there's a judgment. There's a negative judgment. Okay. Because these people focus on, the pessimist focuses on what they don't have. The optimist focuses on what they do have. And the realist just looks at something and says, this is what it is. It's what we call a non-judgmental attitude. Okay. As human beings, we tend to judge. You know, that color looks so good. For example, pink looks so good. But that is our judgment, right? Pink is pink. But whether we like it or not is our judgment. So ye situation aapko, you have to evaluate, you're not going to be able to change yourself completely. But this is one place to start. कि भाई मैं optimist हूँ, pessimist हूँ या realist हूँ. Okay. I'll give you my example. I tend to be, with some things, I tend to be more of a pessimist. Okay. So I have to watch myself. See, I'm going into this negative loop of thinking again. So I have to step back. I have to take some time and I have to think, अगर किसी ने कुछ मुझे कह दिया, so I have to think, did this person really insult me or did this person try and help me? Maybe the way they said it was not good, but maybe they were still trying to help me. In some things, I'm an optimist. Like, for example, staying at home. ठीक है, घर पे हूँ, I'll do this, I'll do that. You know, so what if I can't go to office? Things will get better eventually. Okay, so none of us are one or the other. All of us have a little bit of all of this, and all of us are different depending on the situation. But what I'm asking you to do is think about yourself. आपका वो कहते हैं ना, natural instinct क्या है? To think positively, to think negatively, or to say, okay, whatever is, it is. So here, these are some other ways to cope with depression. Very, very important. Even in this uncontrollable situation, have a schedule. Wahi time pe utna. Imagine that you are going to classes. Imagine that you are doing what you do every day when the COVID was not there. Planning. I cannot stress the importance of this. And even as I say it, I'm thinking, Durriya, when do you do that? Okay? So none of us are perfect. I'm a psychologist. I'm a therapist. Whole day मैं सबको advice देती हूँ. Lekin there are times that I don't follow my own plan. That is okay. But in general, try to get up at the same time. Try to have your meals at the same time. Try to do whatever you're doing at the same time. कि भाई 10 से 12 बजे के बीच में मुझे study करना है. That's really good. You don't have to have an alarm कि भाई 10 से 12 में ही मुझे करना है. But you know, plus minus. थोड़ा तो अपने flexibility देना है. You don't want to become too rigid also. Go to sleep at the same time. And especially ये जो basic habits है, sleeping, eating, waking up, all of those, have a schedule for that. इससे ना आपको ये जो routine आप करेंगे ना, तो you'll feel better about yourself. You'll feel a sense of accomplishment. कि चलो मैंने ये तो कर लिया, मैंने वो तो कर लिया. So that sense of those little steps that we take will help us improve our mood. अच्छा, मैं आपको एक एग्जाम्पल देती हूँ. आपने बच्चे को तो देखा होगा ना, when they are trying to learn how to walk. जब पहली बार उठते हैं और multiple times they get up, they fall. लेकिन they keep going until they can walk again. You know, that's why kids don't have depression. Because if they fail one time, they keep at it again. So आपको ये बेबी स्टेप्स लेनी है कि ठीक है, मैं गिर गया तो क्या हुआ, मैं गिर गई तो क्या हुआ, आई एम गोइंग टू ट्राई इट अगेन. ओके, little steps at a time, and give yourself credit for those little steps. हमें, you know, we are our own worst critics. कोई हमें कहता है कि you know you didn't do a good job, हमारा internal dialogue क्या होता है, अरे मैं तो बेकार हूँ, I'll never get better, blah blah blah. नहीं, that person just said you didn't do a good job. They didn't say you're a bad person. Okay, so आप ये schedule करेंगे ना, तो आप plan करेंगे ना, तो आपको ये छोटी छोटी बातें अच्छी लगेगी. You will feel like okay, I have something to do or I have done something. Secondly, do not isolate. ये जो social distancing जो कहते हैं ना, I've spoken up against this term so much कि it is not social distancing, it is physical distancing. किसी ने नहीं कहा कि आप फोन पे बात नहीं कर सकते, किसी ने नहीं कहा कि आप वीडियो चैट नहीं कर सकते, किसी ने नहीं कहा है कि भाई आप you know अपने फैमिलीज के साथ बातें नहीं कर सकते या टाइम नहीं बिता सकते. It is physical distancing with people, and it is for your own protection, na? So yeah, आप देखिए, आप वैसे भी when there is no COVID, you get busy with your life, and तब आप सोचते हैं ना कि oh, I don't have the time to do this. So now is the time to do that, because you are physically distanced, not socially distant. Okay, you're not distant in your thoughts, in your emotions. You're just distant. Your body is not in the same room as the body of another person. So get this out of your mind that this is physical distancing. No, this is social distancing. Okay. I think I talked about this already, to have a schedule, you know, basic habits such as eating and sleeping. Okay. Again, अपने आप पे, you know, like be kind, be compassionate toward yourself. ऐसा नहीं है, ये कुछ military rule नहीं है कि आपको you know 5 बजे उठना है और 8 बजे सो जाना है, ऐसा कुछ नहीं है. ठीक, if your habit is 5 o'clock, 5 a.m. in the morning, which mine is not, but if it is 5 a.m. in the morning, ठीक है, चलो बाहर तो नहीं जाना है ना, I can wake up at 6 o'clock. Yeah, give yourself a leeway. By between 5 and 7 every day I'll get up. You know, between 1 and 3 p.m. in the afternoon I'll have my lunch. Between 8 and 10 in the evening I will have my dinner. That's it. Learn to spend time with yourself. Think of something that you've always wanted to do and you've not had the time before. Think of, you know, जब हम life में busy होते हैं, there are lots of things. If only I had the time, I would do this. You know, online classes कितने हैं, free classes. Take this time to develop yourself. Take this time to get to know yourself better. Okay. Just 2 days ago, you know, हमारे apartment complex से they send you these motivational emails, you know, okay, the things you can do during the weekend. So one was on photography with क्या था? iPhone photography. So photography is something that I'm interested in, and I've even taken a class in photography, लेकिन I've never been able to practice my skills. So मैंने कहा कि चलो अच्छा है, you know, and of course that was for a fee, but very nominal fee. Lekin there is a website called Coursera. Maybe some of you have heard of it. Coursera. It offers a lot of courses, both academic and self-improvement. And you can try that. I think some of the courses are offered by, you know, Ivy League schools like Harvard and Yale and all that. And I think the majority of the classes are free. Like think of things that you have not been able to do or have wanted to do. This is the right time. remember that these negative thoughts are your depression talking, not you. Okay. And again, this is critical. Think of ये जो हम कहते हैं ना, things will never get better. That is your depression. That is not you. Because if it were you, that would be your thought 24/7, 365 days a year. Think about the times that you were happy. Think about the times that things were going well. So that is you. The person will think both positive and negative thoughts. Depression will always think negatively. So again, I keep coming back to language. हम लोग अंग्रेजी में, we tell our students, don't talk about I am depressed. Don't say I am depressed. That means you are the depression. लेकिन नहीं, you have depression. आप सोचिए, we don't say, I am cancer. हम वैसे तो नहीं कहते ना, we say I have cancer. So see the difference between how we talk about our mental health and how we talk about our physical health. We don't say I am fever. We say I have fever. मतलब कुछ हो रहा है and it will end. Okay, your depression doesn't define you. It's the lack of awareness, the lack of knowledge that unfortunately gets in the way of you getting better. Use the services available to you, whether it's a crisis hotline. मैं कल ही पढ़ रही थी when I was researching this. There's a lot of push. In fact, there are a couple of articles, a lot of push for the government to set up crisis hotlines, especially during this COVID situation. पता नहीं अब है कि नहीं, लेकिन there were a list of things that the government is being told to do for mental health reasons. So if those services are available, take advantage of it. Okay. I told Dr. Sohail also, and I'm inviting you personally also, आपको, if you need to ask me any questions, I'm happy to share my phone number. I'm happy to share my email address. You can just send me a message. You can send me an email, whatever works for you. Being strong doesn't mean not asking for help. It means knowing when to seek help. And one more thing, help doesn't mean that you go to a professional. No, it also means talking to the person next to you. हमें ना एक चीज की आदत है कि हम जब friendships करते हैं ना, तो हम सोचते हैं कि oh, this is going to be my best friend forever. लेकिन we have to come out of that mode of thinking. Every friend is not going to be your best friend. There are friends with whom आप movie देखने चले जाते हैं. There are friends with whom you will go shopping. There are friends with whom you will talk about the problems you are having with maybe in your family. There are friends with whom maybe you talk about politics. And then there are friends with whom you talk about anything and everything. So try and increase your social circle. ऐसे नहीं कि भाई मेरे ये जो 5 दोस्त हैं, that is sufficient. This is something I learned the hard way. Maybe growing up in Bangladesh, I grew up with the same group, and they are my friends, and if they are not my friends, then मेरे friends नहीं है. अब इस बुढ़ापे में मुझे ध्यान आया है कि नहीं, शायद मुझे I need to have a larger social circle. I'm a very shy and introverted person, so it's very hard for me to go and make friends like that. But फिर भी I have tried. There are some colleagues that I talk to, some colleagues I don't talk to about anything personal. ठीक है, but increase your social circle. And I think that is the end of the slideshow. And I want to open it up to questions now.
You want to take those questions that were there in the chat first?
Yeah, sure.
So the first one was difference between stress and depression.
Okay. So stress is not an illness. Stress is what you feel. आप जब traffic में फंस जाते हैं, that is stress. You know, when you get irritated at something that has happened, that is stress. Stress is an everyday thing. When stress gets beyond your coping ability, तब ये depression, anxiety, or other mental illnesses happen. So, you know, right now the way I'm sitting, it's causing stress on my wrist. So, again, it's a language difference also. So, stress is every day. Every day we feel some sort of stress. Okay, it's normal to feel some stress. It's when it becomes distress that it goes into an illness like anxiety, depression, things like that. I hope that helps.
I think इसको और अगर थोड़ा और explain कर दे ना कि anxiety जो होती है, how does stress convert itself to anxiety?
Okay, so I'm going to give you a simple way of thinking about depression and anxiety. This is not the way we think about clinically, like in just, you know, for a lay person, it's easier to think like that. So depression is when you have sad thoughts about the past. Okay, ये क्यों हुआ, मेरे साथ क्यों हुआ, you know, अब कैसा होगा, that kind of thinking. You know, you're always negative. Anxiety is worry about the future. Okay, so that is why we say that anxiety and depression, both of them are in a way normal under these unusual circumstances, right? We are worried about the future. We are, those of us who have lost jobs are worried कि भाई खाना कहाँ से आएगा. Yeah, you know, when will we be able to return to normal? But when anxiety, in other words, worrying about the future, is all that you are doing, that is an illness. That is a mental health issue. Okay? हम देखें, थोड़ा anxiety, थोड़ा depression normal है, right? Because before an exam, we all feel nervous. That's not anxiety. That is feeling nervous. And yes, you could say that, you know, I have a little bit of anxiety about how I'm going to do on my exam. लेकिन if you are worrying about कल क्या होगा, परसों क्या होगा, इसने क्यों मुझे ऐसा कहा, वैसे मैं कैसे करूँगी, क्या होगा, you know, that is your concept. It is impacting your sleep. It is impacting your normal functioning. That's anxiety.
Okay. All right. There are few that I got in my private chat.
Okay.
Are you ready? Okay.
Yeah, I'm ready.
All right. इसमें कुछ एक जैसे हैं, so I'm just trying to merge them together.
Okay.
तो उसमें ये है कि how can we share when what we are going through when we know that if we tell these things to somebody, they will think us as pagal, or will say things like just you said earlier, go and pray and concentrate on Quran and stuff like those.
Achha. So that is not the person you want to go and talk to, right? That's the first thing to remember. Okay. I mean, maybe I'm not saying that praying and namaz padna or Quran padna are bad things. Nauzubillah, that's not what I'm saying. What I'm saying is that when you're struggling with a mental issue, you do not want to go and talk to the person who will say, "Okay, arey jao, so jao, you'll be fine. Everything will be fine." No, you want to talk to a person who can say, who can listen. Okay, bhai, you're going through something. Even when students come to us, it's not our job to give them the solution. It is our job to help them get to the solution. You know, because we want to help them learn how to cope with situations. So if you, it doesn't have to be your best friend. हो सकता है कि your best friend might be the kind of person who will say, "Hey, don't be, you know, ये सब क्या सोच रहे हैं आप, पागल हो जाएंगे." Believe me, when I went into psychology, that's what I heard. My closest friend, you would say, okay, don't go into psychology, you'll go pagal. You know, so she's not the one I talked to about my future in psychology. I had to find somebody else. So think about those people that you trust. Okay, and again, it doesn't have to be one of your friends. It can be, maybe somebody from your relatives, maybe somebody like Dr. Sohail, Asma Apar, Dr. Asma, or anybody. It can also be somebody you don't know. जैसे वो जो मैंने कहा ना, crisis hotline अगर अब establish हो गया हो, तो you can call them and talk to them. But I like I said, I just read an article about the push to the government. लेकिन I don't know if that's happened or not.
थैंक यू। ये मैं आपने अच्छा रिमाइंड करवाया मुझे भी। मैं कोशिश करता हूँ कि ये बात मैं स्टूडेंट्स को बताऊं कि अगर उनको किसी किस्म की भी प्रॉब्लम हो ना कभी भी, तो दे कैन ऑलवेज कम एंड टॉक टू अस। और अगर कोई भी नहीं है तो दे कैन कम एंड कॉल मी एंड जस्ट टेक्स्ट मी और जस्ट मैसेज मी ऑन व्हाट्सएप और जस्ट ईमेल मी। और ये बहुत जरूरी है कि आउटलेट हो कहीं कोई ना कोई। And let me be very honest, और प्लीज आप इस पे कुछ थोड़ा सा एक्सप्लेन करें इस कॉन्सेप्ट को। As I told you earlier, we lost one of our students 3 years ago. He's committed suicide. And I did talk to my student, I think 4 or 5 days before his death. And the reason I called him was that I saw a really big decline in his grades. So I got worried about him. As what's going on? Let me know if I can help. And the person didn't open up with me. And he was basically being bullied in the university. And he came from a very poor family. And he struggled and he came to the big university, and then he could not cope with the taunting that was going on around him. So I keep telling my students that please, if you have issues, go and come and talk to somebody. Not me, anybody. But at least I am here so far away from you guys. मैं किसी को जज तो नहीं करूँगा कभी भी. So please, ये डॉक्टर दुरिया ने जो बात करी है, this is very very important. Try to talk to somebody. अच्छा, नेक्स्ट सवाल जो है वो भी बड़ा अच्छा है कि the way you are defining let me read it again. The way you are defining depression, it seems to me like it is a self-diagnosis thing. Is it? Hello, Dr. Durriya. We are not able to hear you. Yes, please. Hello, Dr. Durriya.
Oh, yeah, I'm so sorry. I muted myself.
No problem. So you heard the question.
Yeah, I heard the question. Okay, so no, I would not ask you to diagnose yourself. You may be able to see the symptoms and recognize कि भाई, yeah, I am experiencing all these things. लेकिन आप सोचे कि आपको अगर fever आती है, when you have fever, do you diagnose yourself? Because it could be the flu, it could be tuberculosis, it could be pneumonia, it could be anything, right? तो आप डॉक्टर के पास जाते हैं ना. So why do you treat this differently? Because sometimes it's not depression. Depression के लिए भी हम assess करते हैं. हम diagnosis के पहले yes, you are an intelligent, educated person. Of course, you recognize the symptoms. Like in recognizing symptoms from diagnosing are very different things. So no, I would not tell you to diagnose. और भाई प्लीज डायग्नोज नहीं करेगा, लेकिन क्योंकि फिर हम कहाँ जाएंगे, हमारा बिजनेस का क्या होगा?
Okay, is it possible for someone to have only some symptoms but not all, but still have depression?
Yes, लेकिन वो you can have some of the symptoms, like, and then we wouldn't diagnose you with depression. Like, you have to have a certain number and certain kind of symptoms. For example, that feeling of sadness and hopelessness, if it has been continuing for a month, for example, just if that's the only symptom that you have, then that's not depression. Maybe something is going on in your environment. The other thing I want to say is that, depression ke symptoms are, you have to be extra careful because hypothyroidism can also cause similar symptoms. So that is why it's really important for you to go to a doctor or a psychiatrist or a therapist, because sometimes physical issues can also cause those symptoms. So no, just having one or two symptoms is not enough.
And I think you are right, because thyroid problems जो हैं बहुत ही common है, especially among women. It's very, very common, very common.
Yes.
So एक और है a question, can medication control depression?
Medication can treat depression. See, I'll tell you how medication helps. And we actually recommend medication when the depression, after therapy, depression is not helping. And the other thing is कि अगर depression इतना बढ़ गया हो कि you're not being able to function. I actually have a student like that. She's a graduate student. Coincidentally, she is from Pakistan. I've been working with her for almost 2 years. लेकिन अब because of the COVID, she's एकदम homebound क्योंकि उसके कुछ underlying conditions है. So I can even over video, I can see her depression sort of increasing. She's becoming less energetic. She's very much against medication. Like when I told her, I said, she asked me last time, okay, why are you telling me to take medication? I said, I can see the decline. I can see that she's not taking care of herself. She's sleeping at odd hours. So medication can help you, can give you that energy, because medication changes. Just like a painkiller takes away the pain, the medication will help change your brain chemistry a little bit. You feel a little bit of, you feel a little more energy. You don't have to stay on the medication for the rest of your life. Generally, आजकल जो medications मिलते हैं, उसमें side effects भी बहुत कम होती है, and essentially you stay on them for about 2 years. फिर आप doctors के advice से you gradually taper off.
Okay. So एक बड़ा interesting सवाल है, वो ये कि just like जैसे हमारे पास assignments or projects होते हैं education में, can we say that depression is like the definition of anxiety?
Depression and anxiety are different. वही पूछ रहे हैं ना कि depression.
Depression.
Yeah.
Oh yeah.
Yeah. Clinically, they are different. They are treated differently. So like I said, depression is negativity about the past and the present. Anxiety is worry about the future, generally speaking. Okay. So in depression, you think negatively about yourself, your environment. Anxiety is you worry कि क्या होगा. So clinically, they are different. In everyday term, people use those terms, depression and anxiety. But yes, they do share some symptoms. So sometimes the same medication can help.
Now this one, Dr. Durriya, is a little bit a long, इसने बड़ा लंबा message लिखा है, लेकिन I think it's worthwhile reading. So please bear with me because it has a question near the end.
Okay. No problem.
Sometimes start like this. Sometimes people who have always been motivated in their life and achieved everything tends to neglect their mental health and ending up painting an impression in front of others such that they are super strong and they get everything in life that they set their mind on. At some point, such as during this pandemic, finding a job, for example, deciding on a suitable postgrad degree, staying strong, and generally everything in life exhausts you. What if you are surrounded by struggling people and that you feel like you have the responsibility to take care of them instead? What do you how do you exactly approach it? That's one question. Then it ends up sending me down into a guilt trap that I am being ungrateful and that I'm not doing enough. It's like a vicious circle that I cannot escape. You have to support people around you because you always have, but also it is never enough for me, and I have never given a break or complained anyone because I am too good for that. I am meant to succeed every time because I always have. It is mentally draining me. Additionally, I have developed symptoms of OCD in these last few years, and it's gotten worse. At least that's what I think after reading about it. I can talk to you separately about it since this is going to make the comment very long. I do not know how to get away from it, and it is adding extra burden on me.
Okay. It's a really good question and very applicable for those of us who are high achievers. See, we set आप जो कह रहे हैं जैसे उन्होंने लिखा है कि it becomes a trap. Yeah, you've always achieved, so the expectation is that you will continue to achieve. लेकिन ये expectation किसका है? Those people around you or your own? First of all, you have to recognize that. And अगर आपने, when you are saying no to something, whose guilt is that? Yours? Or other people are putting that guilt on you? If it is yours, then you have to think about it. Because what you've done is created an image of yourself in your own mind. Okay, I am the best. But even the best people have their good days and their bad days. Okay, you have to trust yourself कि भाई आज अगर मैंने किसी से मदद मांग भी ली, there's nothing wrong with that, right? The best of us need help sometimes. We are social animals, right? इसलिए मैं कहती हूँ कि it's not social distancing, it's physical distancing. Okay, first of all, learn to lower the expectations you have of yourself, because we are our worst critics. Okay, जितना गालियां हम अपने आप को देते हैं ना, हम कभी किसी और को नहीं देते हैं. We call ourselves stupid, we call ourselves useless, we call ourselves hopeless, etc., etc. आप सोचे, अगर your best friend comes with the same problems, do you think you'll use those words with them? Never. अपना own भाई बहन अगर कहे कि I'm stupid, etc., etc., आप क्या कहेंगे? Yeah, you are. क्या आप कहेंगे? No, don't think like that. So फिर why are you not you treating yourself with the same compassion? Yeah. So be compassionate, be non-judgmental. जैसे मैंने वो diagram picture दिखाई ना, realist, कि yes, it's a glass filled with water. It's neither half full, neither half empty. All right. So everybody, the most accomplished of us have times that we cannot accomplish. We cannot function at 100% all the time. लेकिन आपको पहले ये समझना है कि whose expectations are these, yours or somebody else's.
इसमें एक और पॉइंट था, वो ये कि if you've been helping out others throughout your life, and those people basically depend upon you, and now that you are struggling and you having problems, so how can you approach this to ensure that you are also helping them out, but you are trying to stay strong. जैसे वो कहती है कि मुझे कोई ये कह रहा है ये कि मुझे कुछ OCDs की भी issues हो रही हैं, तो
जी, sorry, Dr. Sohail, I didn't mean to interrupt you.
No, go ahead. I'm done.
Yeah, OCD is a way of I mean, it's an anxiety disorder, and it means extreme anxiety, and it's a way of bringing control over an uncontrollable situation, right? I don't know what kind of OCD this person has, but whether it's hand washing, whether it is, generally I'm talking about the common ones, being afraid of germs, it's a way of getting control back, right? So yes, you have been used to helping people all your life, but ask yourself, do you have to be the only person helping them? Is there nobody else that can help you help them? Agar if, like you talked about the OCD, if the OCD gets worse, it's going to get in the way of your everyday functioning. फिर आप कैसे help करेंगे? Doctors भी तो बीमार होते हैं ना? तो doctors अगर बीमार हो जाए and then they are continuing to see patients, वो तो सही नहीं है ना? So my feeling, and I'm guessing here, I don't want to, assume too much, लेकिन मुझे लग रहा है ये based on the question कि the expectations that this person has placed on themselves, it's hard for them to let go of that. हो सकता है कि if they talk to the people that they are helping, those people don't have the same expectation. Okay. So I guess that would be my first suggestion to them. Ask yourself whose expectations they are. The other thing is, if you are noticing your OCD getting worse, then you need to talk to somebody, because OCD can, as the OCD increases, it will interfere in your everyday routine, everyday functioning.
Mm-hmm.
And I think this person also mentioned that they can chat privately with me. That is fine. Please tell them to send me an email, or like I said, I don't have any problems sharing my number if they want to send me a WhatsApp message. Lekin just introduce kar de ke bhai I was, so that I know who it is from.
No problem. We'll handle this thing later. Okay, एक और दो तीन quick सवाल हैं. Would depression affect our sleeps?
Yes, you may end up sleeping too much or too little. Or your sleep, I mean, you may have a difficult time falling asleep. Your sleep may be disrupted. Matlab aap raat mein, you wake up many times and then you can't go to sleep. So yeah, it can be impacted.
Now here is a life learning example, or a life example, I will say rather. Sometimes a person considers that they are losers and cannot do anything in their life. The person is the person surround you disappoints and distract you. What should we do at that time?
So somebody else is a loser. That's what. Okay. And this person, so the person who's a loser, what makes them a loser? Can you ask that question? I mean, why are they being seen as a loser?
Okay, I think the person who must be listening to you should answer that in the private chat that he or she is sending me. Meanwhile, we can move to the next question. Okay. Ma'am, maximally students try to do their best but could not get good or desired GPA, for example.
Mm-hmm.
Then they try again and again, not successful. So it become a long time depression.
Yes.
Is it?
Yeah, I mean, if you're trying and not succeeding, maybe it's time to look at the ways, at the means that you're using to try. Suppose you go for an exam, you don't do well, हम क्या करते हैं, okay, next time I'll study harder, and we do that and we still don't pass or we don't do well. Maybe the problem is not the fact that you're studying harder, the problem is how you are studying. Maybe you're not focusing on what you're supposed to study. So you have to change. If one time something doesn't work, try again. But life may be limited chances hote hain kabhi kabhi. So talk to somebody, again, a friend. I keep saying talk to somebody, doesn't have to be a professional all the time. Talk to a friend, talk to somebody who has maybe graduated. Kisi ko bhi ke bhai, I tried, it didn't work, can you give me some tips? Hamara ego is a huge thing, especially when you're used to seeing yourself as the best. It's almost like we develop this idea that I cannot go and ask for help. Arey bhai, kyun nahi? What is the worst that can happen? Somebody will make fun of you, or somebody will say, I won't help you. Theek hai na, you are back to square one, so you go somewhere else. And I'm talking about this like it's very easy to do. Believe me, I understand it is not easy to do. But somewhere change has to start. And I hope that, my father, mere abbu hamesha kehte the ki every drop makes an ocean. So, which means that even the littlest of change can make a difference. So, hopefully, aaj ke presentation ke baad, there will be one thing that you will try. And then it will have a ripple effect. And I recognize it's not easy.
Definitely, you are right. It is not. It is definitely not easy. I have ये जो क्वेश्चन था ना, ये इसलिए भी इम्पोर्टेंट है कि कई लोग ये मुझसे बहुत करते हैं सवाल के फिर मैं इतनी मेहनत कर रहा हूँ या कर रही हूँ, उसका रिजल्ट कुछ नहीं आ रहा. हमेशा मेरा वही नंबर्स रहते हैं कि क्या मेरा मेंटल कैपेसिटी ही इतनी है या मैं इससे ज्यादा अचीव नहीं कर सकती. दिस इज व्हाट आई एम, हु आई एम. ये जो है बड़ा समझाना मुश्किल हो जाता है कि ये लर्निंग जो है इट्स नथिंग टू डू विद वर्किंग हार्ड. इट्स बेसिकली स्ट्रेटेजी. और अगर आपके सामने एक पत्थर आ जाए तो आप ये नहीं करते कि आप पत्थर को उठा के फेंकने की कोशिश करें. आप कोशिश करें, अगर नहीं उठ रहा आपसे तो साइड से निकलने की कोशिश कर जाए. तो देयर इज ऑलवेज ओपनिंग, यू हैव टू चेंज योर रूट्स. तो ये समझाना जरा मुश्किल हो जाता है बट स्टूडेंट्स को, लेकिन आई कीप पुशिंग दीज थिंग्स टू देम. एक मैंने सवाल तो भेज दिया था उनको जिन्होंने मुझे सवाल किया था, वो आपसे मुझे आई कुडंट गेट द रिस्पांस बैक येट. तो हम ये कर सकते हैं कि अगर कोई सब रिस्पांस आया तो मैं आपको भेज दूंगा. मेरे पास तो इस वक्त कोई क्वेश्चन नजर नहीं आ रहा, ना लाइव पे भी नहीं आ रहा.
Dr. Sohail, do you mind if I share something with the students?
Go ahead, please, Dr. Asma.
अच्छा. अस्सलाम वालेकुम एवरीवन, दिस इज अस्मा हियर. आप लोगों को बहुत सारे लोगों से मुलाकात भी हुई थी पाकिस्तान में. So there are a couple of things that मैं आप लोगों से शेयर करना चाहती हूँ, and that is because that I have been there. I have been in at the same situation जहाँ पे अभी एक क्वेश्चन आया था कि high achiever and people's expectations and all that, and then so it's मैं आपके साथ जो थोड़ी बहुत चीजें शेयर करूँगी, it's based on my like struggle as a student, struggle as an achiever, overcoming all those anxiety issues and everything, and now being in a position where I train people and all that, right? So yes, मेरे साथ भी हमेशा ये expectations रही थी कि being the only एक पूरे खानदान में जिसकी हमेशा positions आती थी. Sometimes अगर कभी नहीं आई तो मुझे लगता था कि how could I wasn't able to achieve जो लोगों की मुझसे expectations थी. Then I realized that वो मेरी false expectations थी अपने आप से, और हमेशा ये सोचना कि I cannot fail, I cannot be achieve what I had planned for, जो मेरे objectives थे. Overall हम सारे इंसान जो है ना, on average we are intelligent beings. We all have few strengths and we have few weaknesses. So अगर मैं हमेशा positions लेती थी, इसका मतलब, और and sometimes अगर मैंने नहीं ली इवन मेरा अपना गिल्ट होता था कि आई वाज एबल टू अचीव इट, एक ईगो वाली चीज. बट देन आई लाइक द पीपल दैट लव यू, योर पेरेंट्स, योर फ्रेंड्स, योर फैमिली, you always want to do something for them. It's not necessarily ये हमेशा जरूरी नहीं है कि आप monetary यानी finance में ही contribute कर सकते हैं. You can share your knowledge, you can share your empathy. आप उनसे अपनी care, अपना love, ये सारी चीजें भी important हैं. आप वो share करें उनके साथ. आप you know it's not position. हम लोगों ने इतने सारे false एक standards बनाए हुए हैं ना कि first position, second position, third position, ये सारी ह्यूमन बीइंग के ही बनाए हुए हैं, राइट? कि आपने अगर इतना ग्रेड ले लिया तो यू आर इंटेलिजेंट. नो, इंटेलिजेंस इज वन थिंग एंड द थर्ड थिंग. लोग रट्टा लगा के भी अच्छे ग्रेड ले लेते हैं, बट नॉट नेसेसरली दैट दे आर इंटेलिजेंट. आई हैव सीन पीपल, मेरी बॉस, शी इज लाइक सिर्फ उसके पास एक अंडरग्रेड डिग्री है. She is the most intelligent being जिससे मैंने बात की है, जिससे she can pick a problem in a बिल्कुल एक जिसमें एक problem को she understands and she finds a solution. So be the problem solvers. Having highest grades and A grades and A plus grades and 90 plus and 80 plus does not mean that you are the most intelligent person on this earth. It does not mean not getting those grades does not mean that you are a failure. मेरी टीम में ऐसे लोग भी हैं जिनकी IQ लेवल इतने ज्यादा नहीं है, बट दे आर सो हार्ड वर्किंग दैट आई डोंट वांट टू लूज देम. बट मेरे पास कुछ ऐसे लोग भी हैं जो आई नो दैट दे कैन डू इट, बट दे आर कंप्लेनिंग ऑल द टाइम. दैट इज वेयर आई ट्राई टू एक्सप्लेन देम दैट डोंट स्टॉप कंप्लेनिंग एंड डू द बेस्ट दैट यू कैन डू. सो आपके पास जो ईगो, मैंने ओवर द इयर्स मैंने ये, एंड नाउ आई हैव कम टू दिस रियलाइजेशन और रिलैक्सेशन के यार I am not a lamia, I am a human being. जो lamia ने मुझे बनाया है, जो मेरी strengths है, I should rather focus on them. और जो मेरी weaknesses हैं, वो मेरी weaknesses हैं. I'll try to overcome those weaknesses as much as I can, but there are only 24 hours in a day. So you do your best, do whatever you can do, but don't underestimate. आप ये हमेशा ये सोचें कि मैं ये achieve नहीं कर पाई. It's good to have objectives in life, but then just see that you are a human being. Empathy, केयर करना, अब जो आपने सीखा है उसको दूसरों से शेयर करना, दैट्स द मोस्ट इम्पोर्टेंट थिंग. एंड जैसे एक अच्छा वक्त था और उसके बाद अब ये वक्त आया है कि द इकोनॉमी इज गोइंग डाउन एंड पीपल आर लूजिंग देयर जॉब्स. ठीक है, अच्छे से बुरा आया, ग्राफ हैज गॉन डाउन, बट होपफुली इंशाल्लाह इन अ ईयर और सो इट्स गोइंग टू गो अप अगेन. हम लोग बहुत रेजिलिएंट हैं. ह्यूमन स्पीशीज जो है ना इस दुनिया में बहुत सालों से सर्वाइव कर रही है. वी आर गोइंग टू गेट देयर सून, इफ नॉट वेरी सून, बट इंशाल्लाह सून. So focus on your strengths. Don't think that you are God. We are not. We are just human beings. So we can do as much as we can. So not getting the grades, not getting the job at this point, and feeling and thinking that you are not useful. No, you can do so many other things that you do not know your potentials yet, but you will come to know them later. So this is the time. जैसे दुरिया ने डॉक्टर दुरिया ने आपसे कहा कि छोटी-छोटी चीजें हैं जो आप लोग सीख सकते हैं ऑनलाइन, उसके ऊपर फोकस करें. And then inshallah, you'll be there, what you have dreamt about. और again, एक time अगर आपका GPA 4 नहीं आया, does not mean that you are not intelligent. You're intelligent, maybe your strength is somewhere else. Thank you.
Thank you, Dr. Asma. Beautifully said. मैं ये बात बहुत important है. और आखिर में मैं एक बात कहूँगा स्टूडेंट्स से जो कि नेट स्कॉलर्स के हैं कि देखिए, जब आई थिंक आसमा भी ये कहेंगी, जो भी NED से निकला है आज से कोई 10-15 years ago, तो हमारे ज़माने में कोई इस तरह की सर्विसेज नहीं होती थी. अभी भी जो हम आपको सर्विसेज प्रोवाइड करते हैं ना NED स्कॉलर्स को, तो वो भी हमें मालूम है कि किस तरह करते हैं हम आप लोगों को. लेकिन ट्रस्ट मी ऑन दिस वन कि जो स्ट्रेसेस से आप लोग गुजर रहे हैं ना, दे आर नॉट न्यू. कोई और पहले गुजर चुका है और बहुत से लोग गुजर भी रहे हैं. आपके अपने फ्रेंड्स में से जो NEDians हैं या नॉन NEDians भी हैं, वो सब इस प्रॉब्लम से गुजर रहे हैं जिससे आप गुजर रहे हैं. प्रॉब्लम यह है कि हम उसको कितना बड़ा इश्यू बनाते हैं अपने लिए, हम खुद क्रिएट करते हैं. डॉक्टर दुरिया ने बहुत सही बात करी थी अभी थोड़ी देर पहले कि प्रॉब्लम्स तो हम खुद अपने लिए खुद क्रिएट करते हैं. हम इतने बड़े क्रिटिक हैं अपने. लेकिन असल बात यह है कि आपके पास एक आउटलेट है, आप किसी वक्त भी मुझे, डॉक्टर अस्मा, हम दो तो आपके मिस नाहिद, ये सब तो आपके व्हाट्सएप के ग्रुप के अंदर मौजूद हैं. यू कैन ऑलवेज प्राइवेटली चैट विद देम. आप किसी से भी बात कर सकते हैं जो जिसको आप समझते हैं कि उनसे आसानी से आप अपने आप को एक्सप्रेस कर सकेंगे. तो ये बहुत जरूरी है, एक्सप्रेस करें अपने आप को, दिल में ना रखें, अंदर ना रखें. Get it out of your chest, and inshallah you will feel way better. Dr. Durriya, I really want to thank you again. It's been an awesome presentation. It's been a great discussion. मैं समझता हूँ कि हमने बहुत कुछ सीखा होगा और होप स्टूडेंट्स ने भी बहुत कुछ सीखा होगा आज की टॉक से. लेकिन I really appreciate again. I'm pretty much sure that there will be questions later on, and मैं इंशाल्लाह वो आपको pass on कर दूंगा. But again, on behalf of the NED and directors of NED Scholars, I really want to thank you. Thank you, please.
Of course. Thank you very much, and it was my honor that आपने मुझे invite किया. I'm so touched.
No, ये हमारे जमाने में ऐसा नहीं होता था, लेकिन मैंने अब देखा है कि पिछले for the past 5 to 6 years, the number of student suicide in Pakistan have tripled.
Yes.
ये हमने कभी सुना भी नहीं था, हमारे जमाने में कभी ऐसा नहीं होता था. जैसे डॉक्टर असमा ने कहा ना कि यार ये तो ग्रेड्स तो आने जाने वाली चीज है, लेकिन जिस तरह के हमने प्रेशराइज कर लिया है अपने आप को, दिस इज वेरी वेरी bad thing. Thank you, Dr. Durriya. Thank you, Dr. Asma. And thank you all who have attended. Yes, please go ahead.
Dr. Sohail, एक बात मैं कह सकती हूँ कि part of the reason is social media. You know, हम एक कुछ होता है and everybody hears about it. Disconnect. That's the best thing you can do. If nothing else, disconnect. Even for half an hour a day. आप देखेंगे it'll help.
Yeah, you're right. Thank you.
Yeah, okay.
Strive for continuous improvement instead of perfection. Thank you. Thank you, Dr. Asma, for sharing that. Kim Collins. All right, thank you. Inshallah, we'll see each other very soon.
Inshallah. Allah
Thank you.
Hafiz.
Allah Hafiz.
Allah Hafiz.